Hi, everybody. Welcome to episode 14 of Homeopathic Voices from Around the World. My guest today is Dr. Jitesh Sharma from the JDS Hospital in India. So Dr. Sharma has actually been on before as well, just waiting for him to connect. Should be a very interesting episode today. We are going to be talking about sexual diseases and also fertility and how amazing homeopathy can be in such diseases. Hi,
Hi,
Dr.
good
Jitesh
morning.
Sharma. How are you?
I'm good. I'm good. How are you?
All right.
Good evening.
It's always a pleasure and delight to have someone as humble as you, but also as famous as you on the Insta Live.
Thank you. It's all due to my students, and I'm glad that they learn a lot, and I'm able to at least help at somewhat at the best I can do. That's I'm trying to.
I think I was just before we went live, I was looking at the reels that we're collaborating on and
Yes.
on the other socials. So we're upwards of about 6,000 views across the board, you know. So your students are very, I think it's supportive is the word, you know. It's good to
Yes.
be able to do that. Being supportive of one another in homeopathy is so important, isn't it? Because we can't go it alone. We have to confer, we have to confide, we have to share ideas. This is homeopathy, right? Oh, you've just frozen. I'm not sure what happened. We'll just wait for the connection to be restored. If you have any questions, please do send them through here. We will try to answer them, but if you can wait until the end, so if you give us about 30 to 40 minutes, and then I'll make the announcement again for questions, and then we can concentrate on the feed as the questions pop up. So, Dr. Saab, how has your day been?
Uh, it's off day for me today. We keep off on Thursday,
Oh, nice,
and
nice.
we work on Sundays.
Did you do anything nice or just relaxing?
No, just read few
Oh,
books.
okay. So today we're going to be talking about sexual diseases and fertility.
Yes.
It's certainly in the West, and you can, of course, provide more information as far as how it is in India. But certainly in the West, sexual diseases are quite common now, especially when we look at also fertility, which sadly and unfortunately, you know, is affecting so many couples who are newly married, and you know they're waiting for years, or sometimes they're just trying one cycle after another of IVF, and still there is no relief for them or any good news or joy, you know. But yeah, I'll let your wisdom speak about the sexual diseases that you encounter and how homeopathy approaches such cases, and you know how it ends up curing.
Uh, it's basically taking the history first, like in the normal procedure. The case taking history actually speaks about if somebody is complains of prostration, lot of weakness, and you give back in the history that he used to masturbate a lot, and he is just one side of minded that he needs to think of a lot of sexual thoughts all the time prevailing. So it becomes easy to prescribe one certain remedy like acid fast. So likewise, there we need to see what actually the wrong, where did the person went wrong. So we need to first, I would say, it's not about more of prescribing homeopathic medicine. It's more of first counsel the patient more in these type of, especially. when it comes to even in premature ejaculation or in erectile dysfunction, or this I'm talking about the male or sexual disease. And regarding infertility also, we need to see what has went wrong, or what they have as the major infertilities now is more of abuse of OCP, oral contraceptive pills, where they are popping up like just
mm,
like anything.
mm,
And I'm sure pretty West you agree in what is going on in West is very like young girls also abusing like anything, and later on in the later life they're having difficulty in conceiving it. So they don't know the adverse effects of consuming OCP, and there are many part of the life. In fact, the stressful job what they are having, and they want a baby and they plan very late. So age factor is actually an important always for the fertility part, because if you plan at 34, 35, you plan to have a baby, that's actually is full of complications. And we have so much of autistic child, cerebral palsy child, retarded child. This is the main reason, because your hormones starts going down at that time, and it becomes a very difficult task to keep a baby alive inside the womb. And it's always healthy to have a certain things in a healthy time. So if you plan it very late, like post 35, it is full of complications for all the women who are planning late for the child. It's very late. You should at least before 35 you try to have it as soon as possible. And it's no wonder you have a healthy life. Still, you never know what complications you're going to carry
mm,
after that, because that is a worst period after post 35 to have a pregnancy, because by you have only 10 years to hit the menopause, and by the 45, 40, 41, you're already draining down with a lot of complications. You'll find fibroids, you start having polyps, you have major complications. Like they had a history of miscarriage and they went into DNC. Then later on, what happens post DNC? There are a lot of complications. We have seen like cervical polyps come up usually when post
mm,
DNC later on, because there's a due to curettage and everything. You never know. It depends to body. Those who have a psychotic tendency, definitely they can get
mm,
anything. Might be polyp, might be fibroid. So it's we need to aware more people about it, that please maintain a healthy lifestyle first, and you please plan accordingly. What's your age and everything? That actually matters a lot in your fertility period. And even with the male especially, who are working a lot, and like you have no time for the family, they're just stressed out a lot, irritation, anger, frustration. So you a lot of suppression inside of anger, and you find some problem, then definitely you can think of statistic area. So this I'm giving an idea about it,
mm,
but it's
mm.
the age factor and the stress. There are multiple reasons why a person is falling sick, maybe in sexual diseases or maybe in infertility. Infertilities are like, we in homeopathy we have so many medicines, but we need to find out the real story out of it, that what has actually went wrong, then only we can prescribe the right remedy to help.
I know very much that heightened anxiety can sometimes bar conception. And, I do sometimes speak to couples who come and we confer, and very, like most homeopaths, I'm very transparent because it's about educating the patient as well
True.
on lifestyle choices. And when I always talk about heightened anxiety, the first thing they say is, no, no, we're not stressed about it. But when you talk about it, when you talk about certain things, there's always there's a multitude of things. I'm not generalizing here, but an example for this conversation is, well, there is some pressure perhaps from the in-laws, or there is pressure just within ourselves that we must have a child. And what's your take on that about heightened anxiety actually creating this barrier, this emotional barrier to conceiving?
It will you will never get a like those person never will conceive if they have the emotional stress, because if they tell that my family is pressurizing me for a child,
Mm,
that's never going to happen, until and unless those two people are prepared for it, husband and wife.
mm,
So and they need their own space and time to in with a calmful mind, and they have to plan accordingly when they both are ready. If suppose even if the woman is not ready and she conceives, and the child which is a baby, he'll have maybe he has some problems. Definitely he'll have some kind of indifference, or maybe in the womb, maybe he doesn't have he have some complications, or maybe no fetal heart sound. There are 10 number of complications that relies upon. So everything is connected from here. When you prepare yourself from here, everything goes well. When you think here worse, everything goes worse. And especially in pregnancy, see, that is true in Hindu mythology. What you say, that everything was taught in Arjuna, like in the womb of a mother. So it's same of the thing. Like everything what you see, what you perceive during pregnancy, that actually directly or indirectly affects the child.
Mm.
So maintaining a healthy pregnancy, that is a very interesting part first, that you need to be stress free first. And if you're planning, if see, first of all, in fertility cases, the rule number one is a couple should try at least for 1 year, then they should go to a doctor, not
Mm.
before that. Minimum 1 year. Like usually what happens, they try for 1 or 2 months and they just start popping pills here that, oh, I'm not able to conceive, I have this. No, just start preparing yourself with a healthy lifestyle. You see what you're eating, how's your sleep and everything. Then you plan for, at least you try for one year for the conception, and then if it's not happening, then you consult the doctor or physician or a gynecologist, that what actually went wrong, whether the problem is in husband or problem is in wife. So then then we can categorize the things. Okay, what went wrong? What is the problem? Maybe tubal blockage, maybe endometriosis, maybe whatever might be the causes.
Mm.
But it has some origin inside it. So that way, that way it is related. And I'll tell you the most abused problem by males, that is premature ejaculation. And I'm sure every every male patient who comes with a sexual complaint, he starts with only one line: I have a problem that I cannot sustain. I pass too fast. So please give me a medicine. The first remedy is moral counseling, and advise him that please don't get too much excited. Have patience. The more the adrenaline rush pushes on, the more quicker he'll emit it out. So for these, we have many remedies. I agree, but first you try to counsel. If he understands that he has to calm down, he has to make peace, then only he can actually say, like, Kegel exercises are more better. I would recommend,
Mm.
rather than giving a homeopathic medicine first. Kegel exercises and everything, and then we decide. Still, if it's not happening, then you give a remedy, and we have many remedies. What to start with? Like, there are n number of remedies for premature ejaculation. The like especially titanium metallicum, selenium. But those people are very much prostrated because of this, because they have a background of sexual access history, and those people who are complaints that premature. And I'll tell you, there's a very beautiful remedy, especially for like failed coition. We say, as
Mm.
soon as they try to have the intimacy, they eject out. So that's a beautiful remedy. I don't know how many people know about it, but if you find a calcarea like constitution and has this problem, there's a beautiful remedy called graphitis.
And also, there's a remedy you may know of called yohimbinum.
Yohimbinum, yes, but I personally never find good results with
Oh,
that. So yeah, so I have more worked, like, compared to Yohimbinum. I found better results with Agnes castors.
interesting, isn't it?
Yeah, and to improvise the semen, quality, the nature, the seminal, the character is like mortality. That generally the mortality, where there is low mortality. So in that, you can think of orchitinum as a nosode. It actually helps in those kind of cases. And in women who has unexplained reason for infertility, actually, if you have a history of any chronic disease in the family, like hypertension or diabetes, if the patient's father or mother
Mm.
has, or grandmother, so medurinum as an intercurrent comes to the rescue. They actually cracks up many cases, and you give medurinum one dose, and you keep them on SL, and just tell them to try. And apart from, like, 70% of cases cracked up very easy. That's
It's brilliant remedy.
unexplained reason. Yeah, that's a brilliant remedy. That's for unexplained fertility reasons. And if you have, like, a lot of tubal blockages and what history, so you need to find, like, if you have a history of endometriosis, and then you give only constitutional remedy helps on those kind of cases. Like pulsatilla is a major remedy for a lot of girls for amenorrhea and the irregular menses, and they cannot
Mm.
conceive. Now, coming to that, if next topic for fertility, like the major issue is that ovulation. there is no follicle. There is very low follicles. There is no follicle formation only. So in that folliculanum, especially on the 10th day, on the 10th day of the menses, like usually the ovulation is like before ovulation, like 14th day. I agree, many girls do not have on a specific 14th day ovulation, but still, if you give on 9th or 10th day as an intercurrent, you can get the follicular study after that. On the 11th and 12th, you can see the follicle growing very big. So this actually, I have in my personal cases as well, that folliculinum comes to the rescue as an intercurrent. 200, one or two doses are enough. One or two doses are enough. It's not even needed repetition as well. Generally, if these all remedies are so brilliant to like help people, and believe me, homeopathy has such a good wider scope in this
Mm.
kind of field where they can actually improvise the health without conventional medicine, and they can get healthy conception as well.
I
So
was going to ask you
yes.
something. You mentioned about, we started with heightened anxiety. And what is your insights into the fact that even if with heightened anxiety and the pressure and the stress, where the body is really not calm, the couple are successful in conceiving a child? Is there some sort of correlation where it can become, let's say, a difficult pregnancy, or there can be some issues with the child? And this is not to scare anyone. I'm just talking from a homeopathic perspective, from observation generally.
Uh, See, depends how they went through and what was the mother history during pregnancy. That's only replicates what the child
Mm.
could have. And if even if a child have something, we have to take during the case taking. We need to ask what actually went wrong in 9 months of pregnancy. Whether husband didn't give her time, because what the wife needs if she's pregnant, she needs a husband's presence all the time. She needs care and everything. When it becomes very separation, then you can see the child can suffer from majorly comes it's with sora. The sora develops there, right? And as Hahnemann has written, if you give sulfur, king of sora, in generally if a third or fourth month of a pregnancy, one dose, that's it, one dose sulfur 30, it actually helps the child to develop the sora, prevent the sora, sorry.
Mm.
So they prevent the sora in pregnancy. And regarding this heightened anxiety, if we take the pregnancy history and then we decide, depends, like the majorly in these kind of heightened anxiety, parents generally the children turn out to be ADHD or more of hyper anxiety, and this I have seen in many children
Mm.
who have this kind of anxiety. So in that also you need to see what where how the mother was there in all the 9 months and what care you need. So even nitromuraticum, tuberculinum, or whatever the history the mother had in their family or father had in their family, that actually helps to help the child to have a good life. So that's what homeopathy can do.
Moving on to perhaps you can't class it as a sexual disease, but a lot of young girls now suffer from, and this is even from very early ages as well, just maybe at the start of menstruation. They're being diagnosed, should I say, rather, not, and then subsequently, of course, they do end up suffering from this condition, which is PCOS or PCOD. So
Yes.
please do elaborate on that, and you share your wisdom.
PCOD are the most easily treated disease by homeopathy.
Mm.
But unless you understand what actually has went wrong, like I told you, medorinum, pulsatilla, epismel, folliculinum, sepia, the most common polycrest can actually cure. I'm using the word cure PCOD if you select the right remedy
Mm.
in that particular patient. Then definitely you will witness it, because see, majorly PCOD is happening because of insulin resistance. And when you know there is a family, their father, mother has a diabetes history, and it is not helping you, you may see which trait, and you can use carcinosin or medorinum as an intercurrent, and then you start with the constitution remedy. It actually clears up the PCOD very well. So this is the right approach what we can use, because what is happening here, you're focusing on the major constitution remedies. Still, okay, like out of 10, 5 to 6 cases crack up with constitution remedy. But where you're failing, you see the past history of the patient's history, where they have a history of this kind of diabetes or cancer or whatever might be the reason. You give as an intercurrent, and yeah, then only you start your constitution. You will see your PCOD is helping out and it's clearing up. That's the way of helping. And I'm telling you, there is no such like rare remedies to clear PCOS. The major remedies are this polycrest only: epismil, pulsatilla, belladonna, podophyllum, palladium, graphitis, calcarea carb. If you see that kind of constitution, these polycrest only clear up. If you confine that, we'll give only specific for that. So it will be a big sorry for them, because they don't be able to treat PCOS. Because what is happening, I'll tell you, he will be focused that I'm treating only PCOD. I need to treat PCOD. You have to see that you have to treat the patient, not the PCOS or PCOD. That's where the problem is.
For the students that are listening, and I know even afterwards many will listen, especially because you're such a legend anyway. So
no, I'm a very, very small homeopath, just trying to learn and grow and evolve and just share my
you're
knowledge.
still a legend. You said very small. I just say you're a very small legend, which is still big. But I was going to ask you about as far as students are concerned,
Yes.
and cases. And when I do lectures and I teach, I always say, be patient. Observe the patient. Be patient
Yes.
as a homeopath. Don't jump and don't go through a list. Forget the
True.
list that it has to
Yes.
be PQRS or it has to be
Correct.
clams or whatever, or general. Listen and observe, because eventually the remedy will come to you, right?
Definitely. The patient will vomit out from his mouth only. But you should learn the way to catch the words, or hold to have a proper view and vision
Mm.
on it, that what actually the patient is vomiting and how do you accept that. And then you search where it has been mentioned, then you crack the case. It's not like just as the patient starts and you take few symptoms. Okay, this symptom is, it's definitely this only, you should start right away. No, even if you feel like, you just confirm them. And if that patient confirms on every angle, like if the person is pulsatilla, he'll confirm on every angle the way you are trying to confirm.
Mm.
If he's not, you will ask the questions and he will deny. At that very moment, you'll realize, okay, I'm thinking wrong, maybe some other remedy. So that way, you should be very confined that whatever remedy you're going to prescribe, you should be confident enough that, yeah, this medicine is going to help.
It's interesting, isn't it? As you're saying that, I was just thinking how important it is, and when the remedies are coming into our head, let's say after once we sort of established, automatic. It's an organic process, let's say, and it's almost mathematical, isn't it? Because remedies are popping in, and as you're consulting, they're changing, and something else is coming up. You're actually repertorizing in your mind,
True.
and of course, we may refer to books and whatever to confer, but generally, it's that process. It's such a fascinating process. Even as a homeopath, going through it, I'm always astounded that why are certain remedies coming into thought, and then they're vanishing because the patient says something else, and you go on a different path slightly. But it's a beautiful process itself, right?
Yes, and as far as I remember, I would like to just share the viewers that the nosodes and sarcodes have a very important role in these kind of diseases as well. And I'm glad that like uh, Forbister has worked so much on sarcodes and nosodes, and Dr. S.P. Day, Dr. S.K. Ghosh has worked so a lot. And by reading everything and by experimenting and by giving the patients as well, we found, like I'll tell you, amenorrhea,
Mm.
severe amenorrhea, and you see there's no development of the like breast, or even very lean thin constitution, and also they have a history of allergic or asthma in the family. Pituitarinum helps them there to regulate the menses, and same way thyroidinum also crack ups many cases.
Mm.
So where you are stuck, it's not that you don't know about it. It's just that you wait for the moment to you wait for the right moment to just give that drug. It's not that you just blindly start with that. You wait for that correct indications, then you hit the arrow, then only you will get the results, or else you'll miss it. So you have to be very vigilant of what case you're handling and how you're perceiving it. So that is very important, and you just prepare with your what we say arms, and the mathematica is the arms. We have everything guarded in a small literature books, everything written in that. We just need to use that on
Mm.
the right time. Then only you can actually aim it with patience, and you can get good successful results. So that is what the major and what is happening here, that many times everybody is trying with the constitutional and they're not achieving good results. So at that time they have to take a help of sarcos and nosots. No wonder if they don't know about it, then literature is huge. Open the books, start reading, and you will get your answers in there. There's no one to hold your hand and just tell them. You need to explore by yourself, and yet the journey you have chosen by your own self. There will be a lot of guidance, there will be a lot of mentor, but the only thing, they can only tell you which books to be read. But after all, it's your part, that how well you are trying to understand that what you have to do in life and what remedies you want to learn, how much knowledge you want. It's not like, see, not to offend, like I feel very disheartened when a homeopath tell I am only this specialist, I am only this specialist. A homeopath is a homeopath. No, you cannot put a tag, I'm an endocrine specialist, I'm a skin specialist, I'm a this specialist. What is this nonsense? You are a homeopath. Hahnemann has told that from cancer to cough, from cough to cancer, you have to see all, you can treat all kind of diseases. Depends. So you be holistic, you're always holistic. You have to deal with the patient, you don't have to deal with some particular organ. That takes, then what is the difference between the specialist and you? Where is holistic here? Where is holistic? You're showing yourself only one part of the organ you are treating. So that doesn't mean that if a cough patient comes, if a patient suffering from chronic asthma, if he comes to the clinic, then what you will say, I am a skin specialist, I cannot treat your cough. Utter rubbish. So this is what is happening around the world. If you are holistic science, you treat everything as a holistically. You cannot take that only one part of the organ, I am here to treat you. In homeopathy, it was never one. It is always as a whole.
I tell you something. It's quite interesting. The reason I was smiling as you said that is just 2 days ago, I had this conversation with a homeopath in Canada, and I was asked a question that, what do you specialize in? I said, I don't specialize in anything. I specialize in everything. It's everything. I said, because we're looking holistically, we're looking at the patient. Exactly. I echo your words, of course, but it's you cannot make it unless it's an acute, of course. Generally, you can't make it medical homeopathy. So otherwise it becomes medical homeopathy, doesn't it? Literally, where you can just go off to buy whatever brand, whatever combination
Yeah.
for general complaints, and that does detract, unless it's an acute, from a majority of cases where the cure lasts, where it is a cure as such, a
Yes.
lasting cure, let's say, you know.
Even I'll tell you, like major of the giving like bio combinations, the cell salts, they are actually hampering the patient on a different level,
Mm,
because you never know the later like whatever symptoms they're developing, and they'll be in a mixed bag when they land up with a homeopath that I read this cell salt to be taken to take calcarea for strict sex, and I was taking since 4 months, and they will start proving the same symptoms. What utterly nonsense. And
mm.
we have to clear all the garbage what they have taken. Like who told to take these nonsense? People like us only, making videos and making, just mentioning, you take this medicine, you take this salts, and you take bio combinations on everything, and everything will be this all utterly garbage. And believe me, this YouTube thing has actually spoiled a lot of things. And if this goes on, everything will be come to a great end, because what is happening here, it becomes very easy to get a medicine. If somebody having colitis, they know they have to take Merxol, and they keep abusing Merxol, and later on they find out they have developed ulcer. So this utterly, for withdrawal of alcohol, somebody viraled a medicine called sulfur. Sulfur is a very big medicine. I had a lot of people visiting to us, and they said, please doctor, give me a sulfur 200. Someone I have read in a YouTube, some great doctor has said that you take sulfur 200, I'll be free from alcohol. Well, what nonsense. I'm not going to give you. You take somewhere else. I'm not going to give you. You ask
I,
that homeopath
I think
only.
you said something very interesting here also, just for the students especially, that the cell salts, which are the biochemic tissue salts. They're called cell salts, they're called tissue salts, they're called biochemic tissue salts. There is a certain process that if somebody is taking them, they should not be taken long term, because they are the
True.
12 inorganic compounds, and you can actually cause damage sometimes in the cells and the structure and the membrane. But anyway, that was just a side comment. I wanted to move towards, we were talking about
You just,
fertility.
yeah, you ask any kind of fertility issues, I can guide the approach and what
Yeah,
homeopathy can do, and any few medicines where the people or students or practitioners getting stuck, I can just provide my knowledge, what I have in it. You can ask,
that's
please.
great. I think before I ask you the question, actually, we are at half an hour. So if anyone has a question for Dr. Jitesh Sharma, just put it on the feed, comment, and he will hopefully answer them for you. But I was going to say that with the myriad of sexual complaints, you mentioned masturbation as well, and that's a big dilemma at the moment. A lot of people can suffer from this, and it can become almost habitual.
Yeah,
Or should I say,
yeah,
it becomes
yes, yes.
habitual, in the sense it becomes part of your psyche, that you cannot start the day or perhaps end the day or whatever time it is. What is the way to overcome this?
To educate them first.
Mm,
See, masturbation is a healthy part, but it's not important that you have to do it every day. It is something just to release, but it's not important you to just abuse it. Like something like you cannot take on a longer break, because everything in excess cause harm. Everything
mm,
in excess cause harm. So you cannot be confident that, because what happened, a lot of misguiding and in the school, because sex education should be a part in the curriculum of the young school students who have hit the puberty, from like all, and I think nowadays, and I know in the West they have already a subject for sex education, and in India also some part they are using it. Some schools have already started sex education, so it is very very helpful for. And even in India there was a movie made for this, specially to aware regarding the sex education,
mm,
and especially, and regarding the topic was masturbation as well. So so it was, slowly the awareness is coming up, and now coming to the remedies part, you have a lot of options, and many the first options, like if they have a lot of thoughts, persistent thoughts, first you have to counsel them. Then you think what actually is happening, and he's getting very anxiety, very guilt, and that kind of, you can think of
mm,
staphysagria, when he has a lot of guilt after masturbation. He knows that he is doing something wrong, but after the post he has a lot of guilt. And so this time, and also for the night pollutions, we call it,
mm,
night falls, like night falls, with a lot of patients come and they ask. So I remember I was struggling with a case, like every night the patient, that's my case. Every night he had dreams, or somewhat no dreams also.
mm.
Continuously every night he's passed out the seminal fluid every night in sleep. That was the case. I was not getting anything. Then I found out a remedy called Ustilago. In Ustilago, it is written pollutions for several nights. Every night and believe me, I gave him Ustilago, and he was suffering. He has took all the homeopathic medicines
Mm.
from various homeopaths, and nothing was working. And he was a pharmacist in a homeopathic medicine shop. So he was my patient, and we gave Ustilago, and he was all right very next day onwards. So that is the power of homeopathy, if you try to understand what actually is wrong. Now coming to the another part, nightfall. If someone has there is no erection, like post nightfall, there is no erection, and he has nightfall without erections. The best remedy comes, that is Dioscorea. Dioscorea, it is written there is no
Mm.
erection after nightfall. That's in nightfall, and this, and even sexual weaknesses, like I think many people know about this psychical impotency. In a mathematical, only one remedy it has been written, psychic impotency. This means he can have sex with other person, but he cannot have sex with his own wife. That is psychical impotency, and this remedy is
Mm.
onosmodium. Okay, erectile dysfunction plus hypertension and especially heart complaints patient. There is one beautiful remedy called Sumbul.
Yes,
Sumbul,
Sumbu.
Sumbul, yeah. Sumbul is a heart remedy, very strong heart remedy. But if a person is suffering from erectile dysfunction plus hypertension plus heart disease, Sumbul comes very indicating. And everybody knows about lycopodium. Lycopodium is the most abused drug in sexual complaints. I believe they have read so many times lycopodium in male sexual, like everything. I have seen a lot of homeopaths making videos on lycopodium, but it's not about lycopodium. It may be any remedy. It's not important. He can be cured by sulfur also. It is
Mm.
not important. He can be cured by pulsatilla also. Even though, even like they you never know what remedy will turn up unless you know the patient very well. What actually is he complaining of? What actually is wrong with
Mm.
him? So that's what the part comes of a homeopath, to understand the patient very well to in order to help him. And it is not important that all the time you need to prescribe remedy. There is a remedy called moral. That is the moral remedy. You need to give moral remedy, and that is counseling.
That's so true.
I,
Absolutely.
Today, a very dear friend of mine, Dr. Ranjan Bilalse sir, is also joined. He is also a very good homeopath, very excellent homeopath with a lot of knowledge, and I'm glad that he's here.
You must you must introduce me to him, and then we can
Yeah,
have him on.
definitely, definitely, definitely,
Um,
definitely.
there are some questions that have come in, so if I miss any questions, I apologize. I'm trying to go through the feed, but there's one here
Yes.
that says, I think you can see if I'm scrolling up and down, I hope as well. So
I'm just trying to do
how
that. I'm
the
just
question
finding.
here, how long after taking homeopathy for infertility and still no pregnancy should you discontinue use? Some people are utilizing for months or years at a time.
That is wrong. Like it depends. See, first you need to find the cause, what actually the problem is, in why you're not conceiving, and then you have to see. Like suppose 1 or 2 months or 3 months, because they need proper follow-ups, and you need proper ultrasound, proper follicular study, and everything. So what
Mm.
happens if you cannot do it? You have to contact with a gynecologist and refer the case and tell them that you are referring them to get a Doppler done or got a USD done, get a follicular study done, check, and yet then you come back.
Mm.
So in like my I have my gynae, we have a well rapport with gynae. They know, and they also, when they also refer the cases to us, that you go to a homeopath because we do not help. So majorly PCOS and endometriosis cases we come up huge. And like PCOS, telling there, my case I shared, right hemorrhagic cyst, like 51 it just disappeared with in just 9 days.
Mm.
Right hemorrhagic cyst. So that's what homeopathy can do. And regarding this fertility treatment, it's not about you taking for years, 2 years, 3 years, still not conceiving. Then you're on a wrong track. It's too long. You cannot waste time, because as you're aging, you don't have time. So there are many factors to
Mm.
see it. So, and it's not like how long. It's like 2 years you are doing homeopathy and not conceiving. It depends what actually your issue is. So unless I know your issue, I cannot tell about it, like how long you have to take homeopathy. But generally minimum to 3 to 6 months are enough. Generally, if there's no major issues, then generally homeopathy can give you the results in within 3 to 6 months minimum.
Yeah, I agree with you. That's
Yeah.
my understanding as well, and experience.
Yeah.
But the next question is, what is the right time for planning pregnancy? This is from Dr. Kalpana.
Any age from like 20 25, like within 30 is the best. Like 25 to 30 is the appropriate. Like before 30, like I in India, in a newspaper, I had my own article, like try to become mom before age 30. So I had published an article in that, and
Okay.
said, because post 35, 36 is hell lot of problems.
Mm.
And this is the major reason. And even consanguineous marriages, that is the biggest problem here, because there's a lot of complications of consanguineous marriage, because ultimately the child suffers a lot in consanguineous marriage. You see a lot of abnormalities, birth defects,
Mm.
suffering from rare diseases, G6PD deficiency, they have some congenital heart defects. This is what is happening when in consanguineous marriages. I'm sorry, but it is actually what is true, what we are seeing in the clinic. I'm talking about
Mm.
that only. So major consanguineous marriages, you see there's a lot of problem with the baby. So that is also a big problem.
Dr. Kalpana Kushwaha is asking again, sir, if males suffering from diabetes, what are the complications, possible complications that one can suffer from?
Depends if the woman, if the wife is healthy, if the wife is healthy, then you have to give the constitutional remedy to the mother to prevent that. If because the husband is suffer from diabetes, and if mother has a history in the family of diabetes, and father also has a very strong family history of diabetes, then definitely later on, whenever if the child has something or issues, and if you see the child get the history like this of diabetes are very strong, and then you can give a dose of carcinosin as an intercurrent one dose with his constitutional remedy, whatever the child might have. This way you can actually prevent him from further complications in
Mm.
life. So this way homeopathy is this nothing like if you give and it will be solved like that. You need to know the right in and out picture about it. It's not just when one shot you give one remedy and that baby will get everything cured. It's not like that. Homeopathy, there are we should prepare ourselves to actually understand patient that what has went wrong, and then accordingly you prescribe the remedy.
Um, there's a question not related to the subject matter, but it's a good question. How long should we take treatment for multiple warts?
Again, it depends. Like since when you're suffering and what's medicine you're already on, and still is not helping, then definitely the remedy needs to be changed. So many patients have a history of in what's in families. The trait is going on. So we need a lot of antipsychotics to clear up. Like sometimes natrum sulf, thuja, medorrhinum in sequence, it helps us to clear these kind of cases. So, and accordingly, you have to select the medicine.
The next question is a very good one because it's on vitamin D deficiency,
Ah,
shoulder pain, and neck
that is
pain.
very important. That is very important.
I
When
was Dr. Jitesh. This week's podcast, my homeopathy podcast, is with Ton Jansen,
oh,
who is the founder of
nice.
homeopathic
Yes,
detox therapy. I'm sure you know.
yes,
And he
yes,
was saying something very fascinating. He said blue light, which is on the screen on the phone here, and I've got another screen on my right, and then and so forth. We're surrounded by screens, right?
yes.
He said they suck the vitamin D, they drain it, and he proved that, and it's so fascinating, isn't it? And so many patients nowadays actually are suffering from vitamin D deficiency. So please do shed your
I
light on that.
yeah, in India, it's huge, and believe me, whatever remedies you are using, calcarea first, and whatever nonsense you are using, cell salt for vitamin D, it's not gonna help. Advise them to get into the sunlight and advise them to take vitamin D supplements. That is very essential. Supplement is nothing conventional, nothing is homeopathy. Supplement is supplement. And if you need it, you have to do it. It's nothing like you have this is you take calcarea first for months and your calcium get developed in the body. This is utterly nonsense. And any cell salt will not actually increase your vitamin D levels at all. This
Mm.
is all rubbish. So you please take supplements. And what is the reason of vitamin D? It has been multiple reasons. How his lifestyle is, what he's doing, and even his gut health. Gut health is a major reason for vitamin D deficiency, and especially the gluten. Gluten kills the formation, and due to that, there is no absorption in the gut, and you lose vitamin D very easily. So majorly patients of IBD and IBS suffers from vitamin D deficiency like anything. They don't know even know
Mm.
about it. Later on, they suffer from joint pains and everything. Then they come to know, okay, I'm vitamin D deficient. So there are multiple causes of vitamin D deficiency. As I don't know the picture out of it, I'm just telling that if there is vitamin D deficiency, please take supplement. It will help you very easily and very quickly. There is nothing like taking homeopathy cell salts, and this homeopathic medicine can raise up the vitamin D. But let me share one light. In spite of taking vitamin D supplements, your body is not absorbing. There is a remedy called vitamin D in homeopathy. You can take as an intercurrent 1 or 2 doses. If your body, in spite of taking vitamin D supplement, not absorbing it, then it can help.
That's
This way, homeopathy
that's
works.
so important because a number of patients I prescribe this to with exactly that. Because sometimes you can take mountains of supplements and there's no difference to health and well-being. And that's the problem. It means absorption or malabsorption. It's not happening. The body is not assimilating,
Yes.
and that's so important. That the beauty of homeopathy there is in well, for me personally, a decimal potency, for example, of a vitamin C, B, whatever it is, D here. It works wonders because they're actually then able to absorb the positive benefits of the supplements they're taking. It's
Yes,
so
yes.
important.
In old age, you have seen a lot of spondylolisthesis cases, stress
Mm.
fractures, and what they give parathyroid hormone shots. And in spite of taking parathyroid hormone shots, the patient is not at all improving. You give parathyroidinum 200, it acts as an intercurrent, and it is help.
Mm. We have another question. Your opinion, this is from the Mohan. Your opinion on mental metaphorical rubrics, your
Oh,
interpretation. That's a tough one,
I,
isn't it?
yeah, I'm not into so much meta-analysis and metaphysics because I feel whatever Hahnemann has given, that is the most important symptoms. And the people who are actually metaphysing and meta-analysis and whatever meta anything is, multiple thing is going on of the rubrics here and there, I am very out of it. And I'm a very simple homeopath. I don't know even one out of it because this this meta-analysis of each and every rubrics, this is not cup of my tea. And I am out of it all the time because
That
I
makes
am
you
very
that
simple
makes you
homeopath.
more of a legend, no?
No, no. I'm a very, I'm a more of a polychrist person. I like to prescribe simple and I like to keep it homeopathy very simplified, very simple. I don't like to just break and just meta analyze and just break things and just go into deep analysis. This remedy can break this. If this remedy can break joint the bones, this can joint everything in your family and everything. This all nonsense. I'm out of it. Whatever might be their discovery, but that is not my that is my entirely my opinion. This, I believe homeopathy is simple and we have to use it in a simple way. We don't have to just go inside a person's life and just take out every line whatever he said, just interpret only one line and just make out of the rubrics and you just prescribe whatever remedy comes. In that you will have only 4 to 5 remedies in your whole life you're prescribing on that.
Mm.
So that is not homeopathy. You have more than 8,000 medicines and you never know what medicine will come up and what medicines can, because see, many cases get clear by one remedy and many cases need a series of remedy with the when the picture comes out clear wise. So you never know what remedy is coming up next. So this way homeopathy helps. It's not like pulsatilla. If you give in pulsatilla amenorrhoeic cases, if it's solving a problem later on, if she have some any great shock and in that she faints and she gets hysteria, you may have to prescribe
Mm.
ignitia at that time. So it's
Mm.
not that if you give pulsatilla, then later on that hysteria will be cured by pulsatilla. You need to see what actually was the exciting cause, and then you have to prescribe that remedy. So major cases need series of remedy to clear the picture out of it, and many cases cracked up with one single remedy only.
You I found here, I'm not sure what it's like in India, but certainly in the West, because people are used to the conventional system. So there's always 30 tablets for a month, for example, or there's TDS dosage or BD, whatever it is, and they know it's a course. Like just like antibiotics, generally it's a course of 10 days, 14, or sometimes further. And I always get asked this question about homeopathy that, oh, how long is this for, or this, how long do I take, and is this a course? It's so important, isn't it, for people to understand that with homeopathy, you need to keep that relationship with the doctor, the homeopath, because things change, symptoms change, progress occurs, and remedies need to change, or they need to evolve according to where the patient is.
True, true. And only your homeopath knows that what he is giving to
Mm.
you. So it's very hard to comment on that because we really don't know what he has been prescribing, on what basis he has prescribed it. So first of all, never condemn any other homeopath that he has given a wrong medicine, even if you know the medicine. Might be his understanding on that basis he
Mm.
has given it. Let it be. Let it be. What you understand with the patient, you first, because what happens, many patients come from a homeopath referred. Just you tell them, okay, what medicine you have taken. If you know about them, just tell them. If you don't know, it's okay, no problem. Because what happens, you will when you take up the case, you will see lot of symptoms coming up. Then you will come to know, okay, he used to take a lot of
Mm.
medicines. So then only you'll have a mixed bag of all the remedies when you take up the case. So this actually happens when the case taking only. You'll get that, okay, this patient must have taken so many remedies. He's telling these all precise symptoms of this particular medicine. This cannot be happen. So
Absolutely.
that way it's easy to figure it out.
There is a question here. Dr. Kalpana is on fire today. A lot of questions, good ones as well. So I think you can see it. If a woman does not want allopathic medicine like folic acid during pregnancy, what is the role of homeopathy in pregnancy?
We don't have anything called like folic acid in homeopathy. Folic acid is folic acid. Simple.
With an intercurrent.
Yeah. We don't have any apart from that. We don't have anything that which contains folic acid. Especially folic acid is more of a dietary thing as well. And if suppose a deficient and if she's deficient on it and she is have any anemic history or in a RA family history, then she must have continued the folic acid for a time being. And it's not like you give calcarea phos or ferrum phos. In that cases, you will actually help them. It's not like that. This folic acid has a own way to work in mechanism in the body. So we don't have anything for homeopathy apart like for especially for folic acid deficiency or in pregnancy to maintain folic acid. We don't have anything.
Lastly, no questions now, but I was going to ask you that, I was actually going to tell you that since you were on last time, I've been thinking and I was pondering rather and reflecting that, and I don't want to put you on the spot, but you're in such a such a blessed situation where you are working in a homeopathic hospital, a very amazing one, and serving patients, left, right, and center. And I just wanted to say that it's very inspiring and it's very humbling to think about it, but it's really, really good. And how many students or those interested in homeopathy you must be motivating or inspiring. So, may God bless you for that.
Thank you so much. Thank you so much. And I believe if 1% also, if I'm able to deliver myself, my work is done. That's what I'm trying to do.
Well, it's been a pleasure, and I hope that in a couple of weeks we can do another one on different
Surely,
subject matter.
different
This is
topic.
going to
Yes.
be quite a regular one, I think. You're a
Surely,
returning
I'm
guest.
always ready.
Legends need to return again and again.
No, it's my pleasure. It's my pleasure to be here.
Okay. Well, thank you so very much, and I will
Thank
speak to you
you.
very soon.
Thank you. Thank you so much. And thank you everyone for joining today.
Yes, thank
Thank
you,
you.
everybody. It's been really, really good today.
Thank
Thank
you.
you. All right.
Thank you.
Bye-bye. Take
Bye.
care.
Bye.
Bye.
Take
Bye.
care.